This video clip demonstrates hysteroscopic features of chronic endometritis. Chronic endometritis is characterized by the presence of plasma cells in the endometrial stroma and persistent inflammation and edema of the endometrial mucosa. Chronic endometritis can be caused by gram-negative bacteria, including Enterococcus faecalis and E. coli. Other bacteria include Mycoplasma, chlamydia, and Streptococcus. The prevalence of chronic endometritis ranges from 1.4% to 58%. Majority of patients are asymptomatic, but they can present with infertility, recurrent pregnancy losses, recurrent implantation failures, abnormal uterine bleeding, and chronic pelvic pain. Diagnosis of chronic endometritis could be clinical and/or histological. Clinical diagnosis of chronic endometritis is essentially by hysteroscopy, and accuracy here could be up to 70%. Features seen on hysteroscopy include micropolyps, which are the main features, hyperemia, which will be focal or diffuse, strawberry endometrial picture, hemorrhagic spots, and endometrial interstitial edema. Histological diagnosis of chronic endometritis is done by demonstrating the presence of plasma cells using CD138 as a marker of plasma cell in the endometrial tissue sample taken during hysteroscopy. This could be done using Hematoxylin and Eosin stain or by immunohistochemistry. Detection rate is better when we use multiple myeloma transcription factor rather than CD138 as a marker of plasma cell in the endometrial tissue sample. Igenomix in Spain has a kit using PCR to demonstrate bacterial DNA in the endometrial tissue sample as well. However, presently there are research going on to link microbiome present in the endometrial cavity as etiological cause of chronic endometritis. This video demonstrates numerous micropolyps, strawberry appearance of the endometrium, interstitial edema, hemorrhagic spots, and hyperemia. Close to the end of the video, a gentle manual vacuum aspiration was done and the sample sent for culture and sensitivity and histology. Treatment of chronic endometritis is mainly by giving broad-spectrum antibiotics, which includes doxycycline, ciprofloxacin, co-amoxiclav, sometimes given in combination with metronidazole. It is also better if we base the treatment on culture and sensitivity reports from endometrial sample taken during the hysteroscopy. It is advisable to do a second look hysteroscopy to ascertain if second course of antibiotics is necessary.